Have you ever felt it? That sensation, not quite painful, but just irritating enough to make you stop what you're doing.
That little persistent itch.
Yeah, exactly. We all have. You pause, you give it a quick scratch, maybe you glance down and you see absolutely nothing.
And the thought process is immediate.
Oh, completely. It's, just dry skin, or must be the winter air, or, I've got to switch my laundry detergent again. It's just, it's a totally forgettable everyday thing.
It is. And because it's so common, we're fundamentally conditioned to see itching as just a surface problem, a skin issue.
A dermatological thing.
Right. The first impulse is always, reach for the lotion, grab the hydrocortisone, change something on the outside. We just assume the messenger, the skin, is the problem.
And that if you fix the skin, you fix the signal.
Exactly.
Well, that cultural conditioning, that's exactly where we're going to start our deep dive today. Because our sources, they reveal this startling connection that's often missed, even in general practice. In older adults, we're talking especially those in their 60s, 70s, 80s, those small, nagging, invisible itches can be the absolute earliest warning system the body has.
The very first whisper.
Yes, the first sign of a serious internal development, something that hasn't even produced a lump you can feel, or that deep pain, or even the fatigue we always associate with a major illness.
These are the symptoms that come before the major symptoms. They're the chemical or the neurological changes happening systemically. And the skin, because it's our largest organ, it's just reporting back to the brain what it's sensing internally.
So these patterns, it's not just a random itch.
No, not at all. These specific patterns, the location, the persistence, the quality of the itch, they are repeatedly documented in specialized medical research. We're talking about links to lymphoma, leukemia, pancreatic cancer, and even inflammatory breast cancer.
So our mission today then is really about translating that specialized knowledge into, golden knowledge for you.
Yeah.
It's all about empowerment, early detection. This isn't about fear.
Not at all. It's about awareness.
We want to transform what feels like just a mundane nuisance into a proactive tool for your health. Whether you're in that age bracket yourself, or you're supporting a parent or a loved one who is.
And the core question we're really tackling is, it's kind of existential. Why does the body sometimes whisper through the skin through an invisible itch before it starts shouting with all the typical symptoms?
Right. Why that specific signal?
Well, the simple answer is that as the body ages, its mechanisms change. Tissues can become less sensitive to pain, inflammatory responses slow down. But the nervous system, if it's being irritated by circulating toxins or inflammatory markers, it is still desperately trying to communicate.
It stops shouting and starts whispering.
It really does, and we need to teach you how to listen to those specific whispers.
Okay, so we're focusing on 5 distinct, silent, localized itching patterns.
5 specific signals that just defy any topical explanation, and crucially, they defy any topical remedies.
Let's make sure you know exactly what to look for.
Yeah.
Okay, so let's really unpack this distinction. Because if we're telling people not to dismiss every single itch, we need the clearest possible understanding of what makes these itches different.
Yes.
What's the character of a cancer-related signal versus, a random mosquito bite or a patch of dry skin?
The distinction is absolutely vital. It's everything for diagnosis. A standard dermatological itch, the kind you fix with lotion, usually on the surface. And it's almost always accompanied by visible signs.
Redness, flaking, a little rash, something you can see.
Exactly, something external. And critically, it responds to treatment. You put on a good moisturizer or an anti-inflammatory cream, and you get relief. It's predictable.
But the patterns we're focused on today, all 5 of them, they share a totally different set of traits. The sources keep highlighting that the sensation feels deep.
Internal.
Yes, internal, or even restless, like a kind of crawling anxiety, even when the skin looks perfectly normal. You scratch and you scratch, but the itch just seems to be coming from somewhere deep beneath the surface.
And that lack of a visible external cause is the single most important characteristic, which leads us right to the core scientific twist here.
Okay.
We're dealing with pruritus, that's a medical term for itching, caused by a neurological pathway, not a dermatological injury. The overarching finding is that many cancers reveal themselves through nerve irritation long before they produce a lump or pain.
So the skin isn't damaged at all?
Not at all. It's just acting as the exit point, the messenger for an internal electrical signal that's gone haywire.
Okay, let's go a little deeper on that nerve action. You mentioned specialized receptors.
Yeah.
Can you walk us through the actual mechanics? How can the cancer in, say, the abdomen communicate with the skin on your back?
Sure. It all starts with the nervous system's very specific alarm bells. For a long time, scientists actually thought itching was just a mild form of pain.
Right, like they were on the same spectrum.
Exactly. But we know now that's not true. We have these specialized, very thin nerve endings in the skin called C fibers. And some of those signal pain, but a completely distinct subset, the proreceptors, they only signal itch to the brain.
So the body has dedicated wiring just for this one irritating sensation.
It does. Now, when your skin is dry, it activates these nerves directly through physical irritation on the surface. That's your topical itch.
Okay.
But in the cases we're talking about, the irritation is chemical. As a disease grows or as it affects other organs like the liver, the body starts releasing these inflammatory mediators, things like cytokines, histamines, or in some cases, accumulated bile salts.
And these chemicals are just flowing through.
They're circulating through the bloodstream, and they literally bathe those nerve endings, the proreceptors, from the inside out.
Ah, okay. So it's like an internal alarm bell is ringing, and the chemicals floating around are what's tripping the dedicated itch wire.
That's a great way to put it.
So since the irritation is systemic, not on the surface, no amount of scratching or lotion is going to turn off that internal chemical faucet.
Exactly. The sensation is generated internally. And this transforms the itch from just an annoyance into a really sophisticated form of physiological communication.
So the failure to respond is the clue.
It's perhaps the most actionable, non-invasive diagnostic clue you can have. If the standard remedies fail consistently, if the itch persists despite diligent moisturizing or changing your soap, the source is, by definition, systemic. It forces you to look for an internal cause.
That makes perfect sense. Wait, now that we understand the mechanism, chemical irritants activating these special itch nerves, let's look at where these alarms typically go off. We're going to start with a location that is so easily dismissed. Persistent itching on the shins or calves, especially common in adults over 60.
Right.
And this location specifically has been repeatedly linked in our sources to blood-related cancers.
That's right, particularly Hodgkin's and non-Hodgkin's lymphoma. And this is probably the easiest sign to dismiss because statistically, skin dryness, especially on the lower legs, it just increases dramatically with age.
Real cool.
So people chalk it up to simple circulatory issues or just age-related changes in the skin's barrier. It seems logical.
But the cancer-related itch has a very specific set of traits. We're looking for that deep, burning, or kind of restless feeling. It often gets much worse at night. There's no rash, and it just laughs at moisturizer.
It does.
So why are the lower legs? Why are the distal extremities the target for these blood cancers?
This is where the biology, the science behind the itch is actually quite elegant. Lymphoma is a cancer of the lymphatic system, right? It involves the abnormal growth of lymphocytes, and this whole process generates massive amounts of specific inflammatory chemicals.
These prurigenic cytokines you mentioned.
Yes, exactly. Prurigenic just means itch-causing. Cytokines are the body's signaling molecules for the immune system, but when they're produced malignantly,
They become irritants.
they turn into chemical irritants. These malignant cells are just pumping out specific cytokines, interleukins, and other factors that circulate all through the bloodstream.
But still, why the legs?
It comes down to fluid dynamics. The blood flow is naturally slower in the distal extremities, in the lower legs. So these circulating irritants just have more contact time. They have more time to seep out and activate the nerve endings, the proreceptors in the legs, which are the farthest points from the body's core.
So it's not a rush of chemicals. It's more like a slow, steady bath of these irritants just settling where the circulation is weakest.
That's a perfect analogy.
And that explains why it feels so deep and burning. It's not the surface being touched. It's the nerve itself firing from this, this internal chemical signal.
Precisely. And the fact that it worsens at night is also logical. When you lie down, your body temperature shifts, blood flow changes, and frankly, the lack of conscious distraction during the day allows that low-grade chemical signal to become dominant. It can become intolerable.
A lot of patients report it genuinely interrupts their sleep for months.
For months. Which brings us to the story of George, 75, from Ohio. His experience just perfectly encapsulates the danger of dismissing this.
He had this uncontrollable itch on his lower legs for 6 months.
6 months, and it was his only symptom.
Wow.
And he was given every logical, topical explanation you can imagine. Contact dermatitis from his socks, severe eczema, a reaction to a new detergent, even chronic athlete's foot.
He must have been going crazy.
He was. He saw his primary care physician 3 times. He bought every prescription strength moisturizer. He changed his diet. And the emotional toll of the sleepless nights, constantly scratching until his skin was raw, even though there was no rash to begin with, was just immense.
So what was the turning point? What finally led to the right diagnosis?
His physician finally ordered a comprehensive panel of tests, mainly because George just insisted that the symptom felt systemic, not topical.
He knew something was wrong on the inside.
Yeah, he did. The critical pivot was the blood work. It showed abnormal white blood cell activity and elevated inflammatory markers, which are consistent with the systemic disease. And that red flag led to a CT scan, which finally confirmed he had swollen lymph nodes deep in his chest and abdomen. It was Hodgkin's lymphoma.
The insight from his journey is just so profound. The symptom was chronic, it was localized, it was non-responsive, it was persistent for months before the disease produced anything else.
And his quote, the one we found, really says it all. The itch came before anything else. It was my body's first warning. That should be a mantra for anyone over 60.
It really should. Recognizing that specific pattern on the lower legs could eliminate months of useless treatments and just shave crucial time off a diagnosis.
And improve outcomes dramatically.
Okay, our second silent itch is, I think, spatially the most confusing. It's a focused, deep, internal itch right between the shoulder blades. Logically, you think back problems, you think muscles, bones, you lifted something too heavy. Why on earth would an upper back itch be the messenger for something hidden deep in the abdomen, like pancreatic cancer?
This is the ultimate example of the body using remote signaling. It's a connection that perplexes patients and, honestly, sometimes even doctors who are only focused on the abdomen.
The sources describe the experience of a woman named Linda as a true phantom itch.
Yes, it's persistent, it's completely unresponsive to any lotion or physical treatment, and the feeling just originates from deep beneath the skin.
So what's the mechanism here? It's totally different from the lymphoma one, I assume.
Completely different. Pancreatic tumors, especially the ones that grow near the head of the pancreas, are notorious for obstructing the structures next to them, specifically the bile ducts.
So the tubes that carry bile from the liver and gallbladder down to the small intestine, they get squeezed shut.
They get squeezed shut. And when that drainage path is blocked, the liver can't properly get rid of its waste products, specifically bile pigment and, critically for this, bile salts.
And these salts are just detergents, basically.
Powerful detergents meant for digestion. But they build up in the bloodstream and become highly toxic, especially to the nervous system, when they're just circulating freely.
Okay, that explains the chemical irritation part, but again, why the upper back? Why not everywhere?
That is the fascinating neurological quirk. It's tied to what we call dermatomal maps. The body's sensory nerves are organized into these segments, or dermatomes.
Right.
And while the liver and pancreas are deep internal organs, the nerves that supply them often share root connections with the sensory nerves that supply the skin of the upper back, specifically in the T2 through T6 spinal segments.
Which is right between the shoulder blades.
Right between the shoulder blades.
So the internal organ is in distress, and the brain misinterprets that signal as coming from the corresponding patch of skin on the back. It's like referred pain, but in this case, it's referred itch.
Precisely. The Johns Hopkins research we looked at noted upper back itching as one of the earliest non-pain symptoms in some pancreatic cases. It's a known paraneoplastic syndrome that arises from this bile salt buildup.
Okay, but wait. If the symptom is so far from the source, how often is this just dismissed as, a pulled muscle or just back strain? How can you tell the difference?
That's a critical question. An orthopedic ache, a muscle strain, that's usually relieved by movement, stretching, heat, or anti-inflammatory drugs.
Sure.
The itching caused by bile salts is not. The sensation is described as a deep, generalized irritation, not a sharp, localized pain. You can rub it, you can scratch it, but you're not affecting the chemical that's circulating, so the relief is it's non-existent or it's gone in a second.
So we have to emphasize the crucial accompanying signs here. If someone is experiencing this phantom back itch for weeks, what are the clear signs of bile blockage they should be looking for?
These are basically the symptoms of early jaundice, and they often show up before the skin turns visibly yellow. If that specific back itch is accompanied by dark, amber, or tea-colored urine, or on the other side, pale, clay-colored stools, that is an immediate, urgent indicator of a bile duct obstruction.
Those paired symptoms are the key.
They confirm the problem is systemic and demand immediate medical attention.
Linda, who was 70, had this experience. She was trying to fix her discomfort with all these external changes, New sheets, expensive lotions, different detergents. A perfect example of treating the messenger.
Yeah, her diagnosis was delayed because the back itch just seemed so benign. She assumed it was dry skin or maybe a pinched nerve. It was only after her doctor ordered routine blood work that they noticed something was wrong.
What did they find?
Her liver enzymes were significantly abnormal. Those elevated enzymes were the secondary effect of the bile not draining.
And that led them to look deeper with imaging.
Exactly. They found a small tumor pressing on the bile duct, causing that upstream chemical backup. It's just a powerful testament to the body's interconnected signaling. The back itch was the persistent anomaly that, when paired with those liver flags, pointed them in the right direction.
It just goes to show your back, which we usually only worry about when we're lifting something, can also be signaling something much deeper in your digestive system.
You have to respect that nerve pathway connection.
All right, moving up the body now to a symptom that I think almost everyone has dismissed at some point, an itchy scalp. And we're talking about persistent itchiness on the scalp, but, and this is critical, without any visible flakes, no redness, no significant dryness.
This is a really tricky one because the scalp is already an area where we're constantly introducing new things. Shampoos, conditioners, styling products.
So many chemicals.
So many. So if an itch pops up, the natural conclusion is, oh, it's a product reaction or it's just dandruff. But when the itch is persistent, and it's often described as a crawling or a tingling or a burning, and it moves around, and specialized shampoos don't help, we have to look internally.
The sources specifically mentioned leukemia, skin cancer, or just a general immune system imbalance as potential causes. Let's focus on the systemic one, leukemia, and the inflammation it causes.
Yes. Leukemia, which is a cancer of the blood and bone marrow, it basically floods the system with abnormal white blood cells. This process dramatically disrupts the body's immune regulation and its inflammation pathways.
So similar to the lymphoma mechanism in the legs.
Very similar. This massive systemic inflammation releases chemical mediators that can irritate nerve endings anywhere in the body.
And the scalp, being so rich in nerve endings and just highly sensitive, becomes a prime spot for this neurological misfiring.
Exactly. The sensation isn't coming from the surface skin. It's the nerves underneath reacting to these circulating chemicals. Patients describe it less as a dry itch and more as formication is the term, a crawling or tingling sensation, or a deep internal burn that seems totally disconnected from the skin itself.
What stands out to me is why this is so easily ignored, especially in older adults. It feels like the perfect camouflage for a systemic issue.
It's the perfect camouflage. As our hair thins and the scalp skin ages, minor irritation just becomes more common.
Right.
So if Henry, who is 73 in the story we read, experiences a daily itch every afternoon, his mind immediately jumps to external things. A dirty hat, static electricity, wrong shampoo, maybe I'm scratching too hard. He just treats it as a daily nuisance he has to manage.
And all along, he's blaming external factors for an internal neurological problem. That's the danger we keep highlighting.
Right. And the key distinguishing features are persistence and the failure of any targeted treatment. The research is crystal clear. A cancer-related itch does not improve with topical fixes. You can wash your hair with 10 different medicated shampoos, you can stop wearing hats altogether, and that itch will come back daily or nightly with no visible cause.
And Henry's story confirms this. He spent months cycling through all these high-end therapeutic shampoos and conditioners. Nothing worked.
Nothing. Eventually, his doctor ordered blood tests, and they revealed chronic lymphocytic leukemia. The abnormal cell activity was already producing the inflammatory environment that was showing up so subtly on his scalp.
I mean, think about the power of that symptom. A low-grade crawling sensation on his head with no dandruff was the very first physical sign of a disease deep inside his bone marrow.
It requires a huge shift in thinking to realize that the persistent symptoms that defy logic are the ones that demand the most critical look.
Our fourth sign focuses on the chest or breast area. And this is a crucial warning, one that is often overlooked in both women and men, which is frankly astonishing given how much awareness there is around breast health.
It is shocking. A persistent itch around the breast, the nipple, or the chest wall can be an early signal of a few issues, but most critically, it's associated with inflammatory breast cancer, or IBC.
And this applies to both sexes.
We have to emphasize that. Male breast cancer, while rare, often presents in a similar way through these subtle skin changes.
The critical point here, the thing that just jumps out from the sources, is that all the awareness campaigns train us to look for a lump. But IBC is defined by the fact that it often does not present with a lump.
That is its defining feature, and that's its danger. IBC is rapid, it's aggressive, and it's characterized by this diffuse inflammation and swelling, not necessarily a discrete mass you can feel.
So the symptoms are easily mistaken for something else.
Easily mistaken for mastitis, a skin infection, a severe contact allergy, and that leads to critical diagnostic delays. The inflammatory process starts causing these localized skin changes and nerve irritation long before a solid tumor is big enough to feel.
So what are the specific red flags for IBC related to itching that you need to have memorized?
You're really looking for a collection of symptoms. First, the itch itself is often described as warm or burning. Second, there might be a tight or a thickened patch of skin. Third, you have to look for a rough, dimpled appearance, which is famously known as the orange peel texture. Medically, it's peau d'orange.
Let's pause on that. Peau d'orange.
Yeah.
Why does the skin dimple like an orange peel in this case? What's happening?
It's a classic sign of fluid dynamics gone wrong. IBC infiltrates and blocks the lymph channels in the skin, the dermal lymphatics. When those channels are blocked, fluid accumulates and the skin swells up.
Right.
But the hair follicles and sweat glands are anchored deep down, and they hold the skin in place, creating these tiny pitted indentations that look exactly like the texture of an orange peel.
That explanation makes the symptom much more understandable, much more actionable.
And fourth, and this is maybe the most important thing regarding the itch, it's a persistent irritation that stays fixed in one specific spot.
Doesn't move around.
It doesn't move. If an itch migrates, it's probably dryness or an allergy. If it stays anchored to one small spot for weeks, that suggests a localized internal anchor is causing the irritation.
That fixed location is such a valuable differentiating factor. Let's talk about Ruth's story. She was 69. She was diligent about her health, yet she was cycling through all these products trying to solve this one persistent itch on her right breast.
Ruth's reaction was perfectly rational. She tried everything, switching to cotton bras, hypoallergenic detergents, all kinds of moisturizers.
And she got zero relief.
Zero. Because the problem wasn't external friction or an allergy, it was the inflammatory process under the skin activating those proreceptor nerve fibers.
And what was the key observation that finally broke through the misdiagnosis?
It was that faint skin dimpling, the peau d'orange texture. Her primary care doctor noticed it during a follow-up visit that was focused specifically on this persistent itch. The itch was the neurological signal. The dimpling was the visual confirmation of lymphatic blockage.
And imaging then revealed the tumor.
Revealed a small, aggressive tumor pressing on the underlying tissue. The persistence and the fixed location of that itch were her critical, life-saving clues.
It really emphasizes that persistence in one localized area is the enemy of complacency. An itch that lasts for weeks in the exact same spot demands an investigation, even if there's no traditional lump. All right, we saved the most sensitive area for last, and the one that definitely carries the highest emotional barrier to seeking care: chronic itching in the anal or genital region.
This is a challenging but absolutely crucial topic, because the source material is explicit about how embarrassment causes older adults to dismiss or ignore this sign, and that leads to diagnostic delays that can span a year or even more.
We have to normalize seeking care for this area.
We do.
What are the specific conditions associated with this persistent itching that warrant this level of vigilance?
We're looking at potential anal cancer, vulvar cancer in women, penile cancer in men, or even localized lymph node abnormalities that are causing deep irritation. And the area is already prone to benign irritation from moisture, friction, mild infections, which acts as really effective camouflage for the more serious issues.
So how does the cancer-related symptom differentiate itself from, the common irritation or hemorrhoids that people typically self-diagnose?
The distinguishing traits are similar to the other signs we've discussed, but maybe even more heightened here. The itching is persistent. It's often described as raw, burning, or distinctly one-sided.
That one-sided nature is a huge red flag.
It's a massive red flag. General irritation, or say a fungal issue, that tends to be symmetrical. A localized, asymmetrical, deep, and non-responsive itch suggests a focal internal tumor or a lesion.
The consequence of avoidance here is just so high. We need to explicitly address that reluctance. The itch is a warning, not a source of shame.
Absolutely. It's so often mistaken for benign things like chronic hemorrhoids, fungal infections, or just skin breakdown. And because of the inherent awkwardness, patients engage in months of private, failed treatments over-the-counter creams, special wipes, diet changes, before they finally accept this is not going away and it requires a professional exam.
Eugene's story, he was 76, powerfully illustrates this. He spent nearly a year convinced he just had stubborn hemorrhoids.
A whole year, he followed every piece of advice you can imagine, increasing fiber, using various creams, taking long, cold sitz baths. None of those common, rational, at-home treatments offered any lasting relief.
But the social difficulty of it just made him persist.
The embarrassment of seeing a colorectal specialist for something he thought was minor just made him keep trying on his own for months and months.
And what happened when he finally sought that specialized consultation?
The colorectal specialist performed a thorough exam and discovered an early-stage tumor inside the anal canal. The critical factor for the diagnosis was the sheer persistence of the symptom, that year-long failure of all topical treatments to fix the deep, specific irritation.
That duration and that non-responsiveness served as the life-saving clue.
It did. It prompted a biopsy. This symptom forces us to prioritize our health over a few moments of awkwardness. If topical or dietary fixes fail consistently, the diagnosis has to pivot immediately from topical management to internal investigation. The embarrassment factor just cannot be allowed to delay that.
Okay, we've covered 5 distinct patterns, from the feet to the head and the chest to sensitive areas. They're all united by one theme, an itch that defies an easy explanation. If we summarize the overarching lesson, what's the one thing you need to internalize right now?
The central insight is this. You can't treat your skin as the problem when the symptom is deep, persistent, and has no associated rash. Your skin is just the messenger. It's reporting internal nerve irritation that's being caused by circulating chemicals or abnormal cells or bile salts. It's the neurological alarm system firing.
So let's give everyone a clear, actionable checklist based on the sources. We need a definitive set of criteria for when an itch goes from being a benign annoyance to a critical warning signal. What are the 4 persistence warnings?
Okay, these 4 warnings should guide your decision to seek urgent, specific medical advice. If you or a loved one has a localized itch, you have to ask these questions. First, duration.
How long?
Has itching persisted for 2 weeks or more? This filters out transient allergies, mild infections, temporary stuff. If 2 weeks go by and that sensation is still demanding attention every day, that's your first sign of systemic involvement.
Okay, what's second?
Second, visual evidence. Is there no rash, no redness, no flaking, no visible cause? If the skin looks normal, or if the changes are really subtle, like a slight thickening or minor dimpling, but no typical rash, the problem is almost certainly neurological or systemic.
Third has to be treatment failure.
Exactly. Third, treatment failure. Has there been no improvement whatsoever with standard, reasonable topical products? We're talking about using quality moisturizers, hydrocortisone creams, medicated shampoos diligently for at least a week. If the relief is 0 or it only lasts a minute, the source is internal.
And fourth,
timing and quality. Is the itching unusual? Particularly if it's nighttime itching that's severe enough to disrupt your sleep, or if it's described as that deep, crawling, or burning feeling. Nighttime worsening often suggests systemic processes are taking over when the body is at rest.
And beyond the itch itself, you need to be connecting these localized symptoms with the bigger picture of systemic illness.
Absolutely crucial. These are often the first signs, but if you pair them with traditional cancer symptoms, the urgency just doubles. Always be on the lookout for accompanying signs. Unexplained, persistent fatigue that isn't fixed by rest.
Right.
Drenching night sweats that soak your bedding. The dark urine or pale stools we talked about with bile issues. Or unexplained weight loss without any changes to your diet or exercise. Those combinations demand an immediate consultation.
So when someone takes this specific, localized, persisting symptom to their doctor, how should they frame that conversation to make sure they're heard and not just, sent away with a basic prescription cream?
You have to be specific and you have to be assertive about the systemic nature of your concern. Don't go in asking for a new cream. Go in asking for diagnostic tests.
Can you give us an example, a sort of script?
Sure. You could say something like, Doctor, I have a persistent itch on my lower legs that has lasted for 6 weeks. There's no rash and no amount of moisturizer or steroid cream has helped at all. I am concerned this might be neurological pruritus related to a systemic inflammatory condition, and I would like a full medical exam, including comprehensive blood work to check my white blood cell count, inflammatory markers, and my liver enzymes.
That reframes the entire interaction. It shifts the focus from dermatology to internal medicine. It shows an informed concern that's much harder for a busy doctor to just dismiss.
It creates an immediate pivot point. We're encouraging you to trust your gut instincts. If something feels profoundly unusual, if the body's normal mechanisms aren't responding to rational topical treatment, then the mechanism itself is likely being hijacked by an underlying process. Early detection really does begin with paying meticulous attention to these whispers and articulating that concern clearly. #TagOuttrip.
This deep dive has, for me, just fundamentally changed how we should view something as mundane as an itch. It's no longer just an annoyance, it's a potential tool. It's an early warning system built right into our nervous system and skin, and it's capable of transmitting vital information about deeply hidden diseases.
It's that essential shift from seeing the symptom as a nuisance to recognizing the symptom as a signal. This specific knowledge, the 5 locations, the neurological mechanisms, the 4 persistence warnings, it provides such a valuable shortcut, transforming a common physical discomfort into a proactive piece of health intelligence.
Especially for the elderly community and those who are caring for them.
Absolutely.
The true power really lies in that subtlety of observation. We now know 5 specific patterns and the biological reason behind them. We're equipped to listen to the whisper before the shout.
And that leads to a final provocative thought for you to consider. If the skin and the nervous system can transmit these vital warnings about deep internal cancers through something as subtle as a persistent itch, a sensation often driven by microscopic chemical irritants, how many other seemingly insignificant physical sensations might also be transmitting vital, life-saving information that current generalized medicine still underestimates? This knowledge really encourages a continuous, critical, and careful observation of yourself. Stay vigilant and keep listening to what your body is trying to tell you.